Okay friends, now let us start with a new topic, that is management of developing dentition and occlusion in pediatric dentistry, or the question might come as space management in pediatric dentistry or occlusal guidance in pediatric dentistry. So we'll be discussing through this topic via this article which was published in AAPD 2020. So introduction. It is very important for managing the developing dentition and occlusion and its effect as it affects the well-being of the infant, children and adolescent. Like this you can write the introduction that the managing the developing dentition is one of the developing dentition and occlusion is very crucial for the overall well-being of infant, children and adolescent. Management includes recognition, diagnosis and appropriate treatment of dentofacial abnormalities. Means what will you do in management? It is very important that you recognize the malformation and you diagnose it at the earliest, and then you take the appropriate treatment for the dentofacial abnormalities. So various recommendations were given to manage these. So guidance of eruption and development of primary or mixed or permanent dentition is an integral component of a comprehensive oral care for all pediatric dental patients. Means the management of the developing dentition is should be an integral, means it should be a must component as a total oral health care for all pediatric dental patients. So now early diagnosis and successful treatment of developing malocclusion can have both, we know, short-term or long-term benefits while achieving the goal of occlusal harmony and functional dentofacial aesthetics. Okay, if you early diagnose the problem, you treat it at the correct time at the earliest, so it will give you a short-term as well as long-term benefit. So there are several factors which affect the treatment, the early diagnosis and the treatment, which includes there are total 10 factors. I have made a mnemonic as PHC at AA triple C. Okay, PHC primary health care at AA and triple C. With P it includes the parental influence, with H includes the habit, with C the craniofacial growth, with A accurate diagnosis, with T treatment timing of the treatment, with A appropriate treatment, with the A is the age of the patient, then with the C is the configuration, craniofacial configuration, with C is the concomitant systemic disease, and another C is the compliance of the clinician's instruction. So now let us go in detail what is it. See, to manage the developing dental arches, minimize the overall success, factors which includes we should know what is the age of the patient, chronological, mental and emotional age of the patient, so that via that only we can understand how much will be the cooperative level. Habit, according to Pinkham, habit depends upon the intensity, frequency, duration as well as the direction. Okay, now parental support is very important. Compliance with the clinician instruction, how much are they following the instructions, the craniofacial configuration, the craniofacial growth, any systemic condition associated with underlying, or what is the accuracy of the diagnosis, what is the appropriateness of the treatment, and when is the treatment started. So these all are the certain factors which will affect the management of the malocclusion. Now, a clinical examination, appropriate pre-treatment records are very important. As then what are the clinical examinations which should include? First, we should do the facial analysis. Facial analysis to identify any adverse transverse growth pattern, including asymmetries of maxilla and mandibular. Identify so first is the transverse growth, then identify the vertical growth, and then identify the sagittal growth. Sagittal growth means anterior posterior growth. Vertical growth will be this is the vertical growth, then this is anterior, this is posterior. So anterior to posterior relation is the sagittal growth, and the transverse growth is the growth pattern of maxilla and mandible. Assess the aesthetics and identify any orthopedic or orthodontic interventions that may improve aesthetics and resultant self-image and emotional development. Orthodontic and orthopedic both improves the aesthetic of the individual and gives a psychological benefit. Next, so these were the clinical examinations. Then the intraoral examination, assess the overall health status of the patient, any systemic disease or condition is there. Then determine the functional status of the patient's occlusion. You must check for the occlusion of the patient. Then functional analysis, determine functional factors which are associated with malocclusion, deleterious habits or temporomandibular joint dysfunction. Okay, so these will be your these will be the protocols for examination. Now diagnostic records are needed to assist the evaluation of the patient's condition and for documentation purpose. It is very important. So, and also you can see how much is the progress of your treatment. So the diagnostic records will include extraoral and intraoral photographs. Okay. Then diagnostic dental cast to assess the occlusal relationship, determine the arch length requirements, if there is any arch length to discrepancy. Model analysis will be done. Determine the arch length requirements for inter-arch tooth size relationship. Then location and extent of the arch symmetry. So first will be the intraoral photographs, next are the diagnostic dental cast, then intraoral or panoramic radiographs are very important. Establishing the dental age, assessing the eruption problems, estimating the size and presence of unerupted tooth, identify dental anomalies or pathology. Okay. So intraoral, extraoral photographs, diagnostic cast, intraoral and panoramic radiographs. Then the lateral and anterior-posterior cephalograms are very important. So they will help in comprehensive cephalometric analysis of the dental and the skeletal components, the vertical, sagittal and transverse growth pattern. It will also establish a baseline growth record for longitudinal assessment of growth and displacement of the jaws. So you can assess the skeletal and dental components, the growth pattern you can access, and determining any dental maturity relative to dental maturity or chronological age. You can access the chronological age and the maturity level of the child in terms of growth. Okay. Then next is the CBCT for hard and soft tissue imaging as indicated by history and clinical examination. Now you must consider differential diagnosis also. Differential diagnosis will establish a relative contributions of the soft tissue. Differential diagnosis and diagnostic summary you have to create so that it will establish these three are very important. This will establish the timing priority of each phase of the therapy, establishing proper sequence of treatments to achieve short-term and long-term objective, assess the treatment progress and update the biomechanical protocol according to the regular basis. Okay, what does it mean? You must prioritize your treatment for each phase of the therapy. Proper sequence of treatment is necessary. First you have to correct the suppose expansion is needed, then class 2 correction. So proper sequencing of the treatment. And next is you must check for the treatment progress so that you can assess from the initial phase and the current ongoing phase. So there are stages of development of occlusion, various principle and includes for the management of various developmental stage. Primary dentition, that is the beginning with the eruption of the first tooth and usually about 6 months of age. So a complete from approximately, and this primary dentition completes by the age of 3 years. Mixed dentition approximately starts from 6 to 13 years. Primary and permanent, both the sets of teeth are present in this stage. It can be further divided into early mixed and late mixed dentition. Then the adolescence dentition, all succedaneous teeth have erupted. Second, permanent molars may be erupted or erupting. Third, molars didn't erupt. And then the adult dentition, all permanent teeth are present. So historically, orthodontic treatment was provided mainly for adolescents, but now it has been established that as early the problem as early should be the intervention. So a thorough knowledge of craniofacial growth and development of the dentition as well as orthodontic treatment must be used in diagnostic and reviewing possible interceptive treatment options before recommendations are made to parents. Treatment is beneficial for many children but may not be indicated for every patient with a developing malocclusion. Some of the anomalies they correct um, as the child grows. For example, in certain cases you might see ankyloglossia, but in many of the cases it subsides on its own. So you do not have to go for a treatment per se at that moment. So, what are the treatment considerations to be taken care of? The developing dentition should be monitored throughout the eruption. This monitoring at regular clinical examination should include, but not be limited to, only to diagnosis of missing, supernumerary or developmentally defective and fused or geminated teeth. Ectopic eruption, space and tooth loss secondary to caries and periodontal and pulpal health of the teeth. You should include radiographic examinations also when it is necessary and if it is feasible. You should also accompany clinical examination. Diagnosis of anomalies of primary and permanent tooth development and eruption should be made to inform the patient's parent and to plan and recommend appropriate intervention. Okay. So, in primary dentition, anomalies of primary teeth and eruption may not be evident or diagnosable prior to the eruption due to the child's not presenting for dental examination or for radiographic examination, or not being possible in a child due to age of or behavior evaluation. So, the objectives of evaluation should include all the anomalies of the tooth number and size, anterior and posterior cross bites you should see, presence of any habit you should see, any open bite, any airway problem. Radiograph should be taken if it is needed. Then for early mixed dentition stage, objective should be to diagnose any unerupted tooth, missing, supernumerary, fused or geminated teeth, tooth size and shape, position of the first permanent molar cup position, developing skeletal discrepancies or periodontal health. Then space analysis can also be done to evaluate the arch length and time of the incisor eruption. Arch length at the time of eruption. Late mixed dentition stage, the objective should be to evaluate the remaining consistent with the prior stage, which will emphasis on evaluation of ectopic tooth positions, especially canines, premolars and second permanent molars. In adolescent dentition, if not instituted earlier, orthodontic diagnosis treatment should be planned for class 1 crowded or class 2 or class 3 malocclusions, as well as for posterior or anterior crossbites. Third molar should be monitored for their position, space, and parents should be informed of the dentist observation. Early adult dentition stage like third molar should be evaluated. If orthodontic diagnosis has not been accomplished, recommendation should be made for necessary. So these are the various factors which you should consider in the various developmental stages. So now these recommendations for this oral habits and other things, we'll cover it in the next video. It is more kind of theoretical rather than practically. So these videos will be little bit long. And if you have any confusion till here, I hope you were able to understand. If you have any confusion, you just post it in the comment section and I'll post a video 2 of this, part 2 of this video. Okay, thank you.